primary data show that we see shorter recovery periods. We see up to 30% less cost overall compared to hospital care, and that without compromising safety. So that is evidence that is coming up, emerging. And I think it goes to show that compassion and efficiency can go hand in hand. Welcome back to the heart of healthcare. It's been a while, and that time away was intentional. We've spent the past few years turning ideas into action, building programs, research, and real places of healing through the Heart-Based Medicine Foundation and the Heart-Based Centers.
Now, as we reconnect here, we're reflecting on that journey, where we began, what we've learned, and how this movement has grown. These 4 conversations close this chapter and open the door to what comes next.
We'll look back at how it all started, the journey. Then we'll explore how the principles in action came to life in daily care. Next, how heart-based insights turned into programs and impact. And finally, what's ahead, the future and our invitation.
Thank you for being part of this story, for every listen, every reflection, and every moment of care you've shared.
Together, we're evolving healthcare into medicine with heart.
Heart-based insights don't stay on paper. They grow into programs that touch real lives. Today, we explore how coordinated integrated care is changing the way people and families experience healthcare. KIDZ, KIDZ, is one of those programs. It's a hospital-at-home program which brings hospital-level medical, psychological, and social support directly into the home, offering safety, connection, and continuity. In Basel, 20 children and their families have already been cared for by the KIDZ program. Parents describe feeling calmer, children recover faster, and teams collaborate more closely than ever before. Jan, you've been part of KIDZ since the beginning. What inspired this idea, and how does it connect to the Foundation's broader vision?
Well, KIDZ was born from a simple question. How can families receive the same quality of medical care and emotional support at home that they would in a hospital, but in a more familiar setting?
Okay. And how does this actually work in practice?
Well, picture this. There's a mother with a child, and let's say that child has a chronic condition. Let's say it's a child with Down syndrome, for example. Mm-hmm. And let's say it's a 3-year-old girl, and she has upper respiratory tract infections. She has a cough and a cold like all kids have at that age, right? But for her, it's more difficult to cough. She doesn't quite have the strength in her muscle tone to really get rid of the phlegm as an otherwise healthy child would. Mm-hmm. And for these children, it's not uncommon to go to hospital not just once, and not just once a year, but actually several times a year with, every time they have a cough and a cold. Mm-hmm. What they need is oxygen, particularly at night. Mm-hmm. And sometimes they need fluids, right? Because breathing really becomes difficult.
Yeah.
So here's an opportunity that imagine this mother is calling her pediatrician, and the pediatrician would maybe recommend her to come into office so it can examine the child. And so as a next step, let's say mother and pediatrician would agree that it's actually safer to go to hospital rather than staying at home. Mm-hmm. So this is going to be another, let's say, disruptive event for the family, right?
For sure.
Let's say mom will go with her daughter to a hospital, and maybe they have another child at home, and then so somebody needs to take care of that child, and then somebody's not going to go to work, or both are not going to go to work, or they need to call in some external helps, and maybe somebody in the family is around and can kind of help out, and every family knows how that works. Right? Now imagine in this situation, the pediatrician will be able to say, you know what, instead of admitting you to hospital, we will admit hospital to your home. Mm. So what if a physician or a pediatrician and a nurse and a therapist as needed would have the ward rounds at your own home? They would come and visit you every day. Mm. You would be monitored all day, as it would be in hospital. You would receive oxygen whenever needed, as in hospital. You receive the fluids as needed and antibiotics if needed. All the good things you can expect from a hospitalization. Yeah. would be possible at home in your own environment, and many things would be easier and calmer. So our experience was that this was very welcome,
Sure.
particularly by families with children with chronic conditions, but also by others, right? Imagine a family with 4 healthy children, and one needs to go to hospital, who's taking care of the other 3, right? Not every neighbor is volunteering there. Right?
I can imagine it's a real comfort for the families to know that this service is provided. So do they have a dedicated physician, or is it a team of physicians that take care?
Yeah, thank you. So it's a dedicated team that is available 24/7. And when you have your, pediatrician nurse from the hospital at home or from the kids team, then they will come and do that. The reason for it to be a dedicated team is that the primary care pediatrician typically just doesn't have the resources and the capacity and availability, right? That's why one of the reasons why they recommend hospitalization in the first place.
Yeah.
So now they can refer to a colleague. The colleague will sort of take care of the patient as if they were in hospital, but just the location is at home. And then at the end, they will get a discharge letter. Well, now the hospital will discharge itself from the child's home. So we have discharged ourselves letter, and then they will be back into primary care.
Yeah.
And if there's a need for hospitalization, just like, there might be a need for a child to go from a regular ward to ICU, right? Then along the same lines, it would be possible for the child to be transferred from the hospital at home to an inpatient setting.
So it's not a replacement, it's a supporting service.
It's an alternative, yeah. And hospitals increasingly are offering these services. In many adult hospitals are doing this already. Yeah.
Yeah. So the first pilot involved 20 children. What did you learn from those families?
It was amazing. We learned a lot.
I can imagine.
We learned a lot, not just by kind of finding out how this works and kind of building the processes and building the infrastructures and learning how to actually serve best, but the impact was tangible.
Yeah.
There was reduced stress, better adherence, and improved well-being. I was really touched by a mother who told us something along the lines of, I finally feel like healthcare sees my child as a person in the family context rather than just as a disease. And these voices confirm that integrated heart-based care delivers measurable results.
Great. So is KIDZ limited to just patients with chronic diseases, or could you give us another example?
Yeah, sure. So let's say, let's create a similar one. Let's say this is a boy, 2 to 3 years of age, and they're primarily healthy, but recurrent obstructive bronchitis. Okay, so what this means is when they have an upper respiratory tract infection, just like the other patient, now this time they have a strong reaction to the inflammation, right? So their airways actually constrict, right, become tight, right? And so now they need medication, and there isn't really a one-size-fits-all dosing regimen. Right? So they need support by healthcare professionals typically through the first 2 to 3 days to really find the right dose and adjust the medication to their needs so that they have less labored breathing, right? Or they need the oxygen levels adjusted, and that needs to happen several times a day, right? So in this setting, the direct contact between the family and the nurse and the physician several times a day is necessary and helpful. And if this happens not just once, but they have, let's say it's difficult to actually manage this situation, which sometimes is, then these children go to hospital 2-3 times in this season, right? Until everybody figured out what is the right regimen for this child.
Yeah.
So every single time when they need to go to hospital, there is now the opportunity to stay at home. And every single time, hopefully the same team is available. So that's very different to a regular hospitalization. And they already know the child and understand their needs. And that helps them to find a solution more rapidly than in a classic scenario. We've seen this a couple of times now with children like this. So primarily healthy children with a very simple, a kind of pediatrics 101 type question, nothing much difficult. Yet they need a hospital environment for their safety.
Yeah.
And in order to reduce the number of disruptive hospitalizations, now there's a possibility to provide that same safety and that same kind of individualized care at home.
And this sounds amazing. Sounds like it really works. But who pays for it all? Is this funded by the amazing Swiss healthcare system?
I wish it was. Right now, actually, home visits, so what used to be standard, right? When, your family physician comes home, right? So home visits
I remember those days.
Yeah. Well, that really doesn't happen much because they're not well paid, and it takes a lot of time, right? And most physicians choose to see clients in the office.
Yeah.
On the other hand, there isn't really any kind of tariff in the Swiss kind of claims-based health system. There isn't really a tariff that helps us determine what the cost is for a hospital at home treatment. There are codes, there are tariffs, there are codes for inpatient treatments, DRGs. And so, a patient with pneumonia would get X amount of money. A patient with gastroenteritis would get X amount of money. Right? The same thing applies for the hospital setting, right? Let's take DRG codes, for example. There is a tariff, so a certain amount of money that is provided, that is given to the hospital or that the hospital can claim for a patient with a certain diagnosis in a standard setting, in a standard situation. So a standard patient with pneumonia, the hospital would get a standard fee. That's the hospital system. In the outpatient system, it's more modular. It's sort of composed of different elements of the treatment. And there isn't really like an outpatient code or an outpatient cluster of codes that could be claimed from a claims agency. So right now it means that the physician is paid too little. It doesn't actually financially work. The nurses sometimes there is a setting where this sort of nursing service at home can be provided, so Spitex. Yet the availability for 24/7, the monitoring, the telemedical assistance in between, and all of that is not really reimbursed. So we're working towards that. So we hope that the pilot project now will give us enough data and will provide a solid evidence base for an outpatient care code or package that could be discussed with the health insurances. Right. So that's certainly something that needs to be developed. Right now, during the project, we're very lucky and very grateful for foundations to step up and help bridge the gap until hopefully a regular payment system can be established.
And from a research perspective, what are you seeing so far?
Well, primary data show that we see shorter recovery periods. We see up to 30% less cost overall compared to hospital care, and that without compromising safety. So that is evidence that is coming up, emerging. And I think it goes to show that compassion and efficiency can go hand in hand.
Yeah, that's significant. And you've been in touch with hospital-at-home initiatives across Switzerland and across Europe. What similarities do you see?
Well, it's fascinating to see all the different attempts now internationally, and in the US, in Canada, in the UK, France, Germany. There's a lot of initiative there, right? So it's really coming, right? It's very clear that in the entire development from inpatient to outpatient care is reflected here, and we see this in adult hospital at home projects, and we've seen this in pediatric hospital at home projects. It's really fascinating. It shows that these programs are not just an idea that will vanish. It's clear that this is here to stay, and in Switzerland we're trying to learn from that, and it gives us the courage to try this. I think what we see is that all these models share the same essence. They're bringing care to where people live. Mm-hmm. They're bridging medical competence and human connection. Mm-hmm. And it turns out that this is not just good medicine, it's good policy.
And what does KIDZ teach us about teamwork and trust between professionals?
Well, so technology is the bedrock, right? So we know we have monitoring in place. We know we have ways to deliver medicines or oxygen, at a remote place. And we know we can trust the technology as we trust it in hospital, right? Yeah. But now it's possible to monitor and guide these processes remotely as well. Mm-hmm. We don't have to be there to change the infusion rate. We don't have to be there, to monitor a patient. You can actually do this from remote. Mm. And so that's the bedrock. Mm-hmm. It's not the technology that builds the trust. It's communication. It's connection. It's when teams truly listen to the families, mm-hmm. to the kids, and when they listen to each other, then families and individuals feel safe, and they are safe.
Yeah.
And it's good fun. What we see is that actually we were wary about whether healthcare professionals actually like to work in these settings. And what turned out is that they really appreciate it because you're not in the same old brick and mortar environment every day. And what changes is the clients. But you actually get much closer to patients and to families. And if you care about your patients, if you care about the families that are under your care, then you get to know so much more. You get to kind of, get a really deep insight into how they're living, and it connects in a completely different way.
Very tangible.
Yeah, a lot of colleagues and are really, they really appreciate this. Yeah. They really appreciate the opportunity to be closer with the families and to serve them better because they understand them better, and it gives meaning to an algorithm that you learned. Right?
Yeah, sure.
And it's fun to adapt the algorithm to the very different environments. It's not just the same kind of optimized environment that you find in a hospital. Uh-huh. You'll have to work with the beds and with the living rooms that are available and the dog in between,
the dog,
right?
Yes.
Yeah. Right? Yeah. Mm-hmm.
Sure.
Yeah.
So looking ahead, what can KIDZ teach us about the future of healthcare?
Well, I think when research, policy, and practice align, care becomes more human and more effective. Mm-hmm. I think KIDZ shows that integrative and well-coordinated care can be scaled responsibly. Mm-hmm. And the same principles can shape adult health services and I think the future of healthcare overall. KIDZ is just one application. It's just one use case, if you like.
Yeah. And taking a different topic now, what about the Heart-Based Centre in Basel? How do these findings influence your work there?
Our KIDZ gives us real-world insight into what people need the most. Clarity, continuity, and trust. And those lessons flow directly into our daily practice. They're bridging research and care in a, let's call it, living laboratory of health.
Ooh, I like that. And if you had to summarize one core message for practitioners and families, what would that be?
That's a tricky question. So if we measure what matters, human connection and continuity, we can transform healthcare from the inside out. Yeah, that would be the message.
We're doing it. Great. Thank you. So what began as a small Basel pilot is now expanding, with 100 families expected to benefit by 2026. KIDZ shows that measurable impact starts with simple human connection, and that research and empathy can grow together. And for the Heart-Based Centre, these insights reach beyond pediatrics. They show how heart-based care and connection delivers tangible results. Next time, we'll look ahead at how the Foundation's research and partnerships are shaping the next decade of heart-based medicine and how listeners can be part of that journey. Thank you for joining us for Heart of Healthcare. These conversations remind us how far this movement has come and how much heart and presence still guide the future of medicine.
What began as a reflection has grown into research, education, and real-world care through the Heart-Based Medicine Foundation. Each story, each voice, is part of that unfolding.
And as this chapter closes, we invite you to stay with us as we continue exploring medicine with heart.
Together we are learning how heart and science can heal not only medicine, but humanity itself.
To learn more or support the Foundation, visit heartbasedmedicine.org.